morning. I am Anna Rankin, coming to you live from RAD-SCI News Station in San Diego, California. I'm here with Claire Daly.
Thank you, Anna. This morning's session is all about radiation-induced sarcomas in response from what an irresponsible CT tech did in California. Michaela Jagger over-radiated a minor, who we will not name for privacy issues. We will refer to him as Bert. He came in for a standard CT exam of his head, a process that should take no more than 5 minutes but took over an hour.
Mary, the young boy's mother, finally put a stop to the radiation madness. The boy had severe skin erythema. He will now have to be closely monitored for the rest of his life to make sure he doesn't have any radiological damage.
This just in, our correspondent Tracy is live at Aurora Memorial Hospital. To you, Tracy.
Thanks, Claire. I'm live at Aurora Memorial Hospital to check on the tech, Michaela Jagger, who over-radiated the little boy, Bert. Michaela, do you have anything to say? Leave me alone.
We are now going to take a quick commercial break. Don't go anywhere.
One size does not fit all. There's no question. CT helps us save kids' lives, but radiation matters, so when we image, let's image gently. More is often not better when CT is the right thing to do. Child size the KVP and MA. One scan is often enough, and scan only the indicated area. Basics, image analysis tool. The beam, make sure the beam is centered correctly. Artifacts, make sure there's no artifacts within your X-ray. Shielding, shield your pediatric patients appropriately. Immobilization and indicators. Immobilize to prevent motion and unnecessary repeats. Collimation. Collimate properly to the sides of your patient. Structures. Is all the anatomy included?
We are now going to take a closer look into sarcomas. A sarcoma is a cancer of the connective tissues, such as nerves, muscles, and bones. Sarcomas were one of the first solid cancers to be linked to ionizing radiation exposure. Sarcomas were first discovered by Beck in 1922. He described sarcomas from a bone that was radiated for tuberculous arthritis.
7 years later, in 1929, Mertland and Humphreys were the first to establish a link between radiation and sarcomas. This link was discovered in female radium dial painters. 42 bone sarcomas were found of the 1,468 painters. The ingested paint caused osteitis, bone necrosis, anemia, and osteogenic sarcoma. The estimated dose of radiation to bone was about 500 gray, and the absolute risk was estimated as 0.1 cases per 105 people per rad per year.
Other doctors, including Cahan and Cuevas, helped strengthen the link between radiation and sarcoma. In the mid-1900s, they reported 11 and 66 patients with radiation-induced sarcomas respectively. More recently, it has been proven that the incidence of bone sarcoma is high among Russians who have worked in plutonium production factories.
Cahan developed a set of criteria to determine radiation-induced sarcomas. The set of criteria include
microscopic or radiological evidence of non-malignancy or malignancy of different histological type before irradiation. Radiation therapy administered to the patient in a sarcoma subsequently developing in the path of the radiation beam.
A relatively long asymptomatic period between irradiation of the primary tumor and the diagnosis of the secondary sarcoma. This period has been reported in various series to range from 3 to 33 years. The diagnosis of the secondary sarcoma has been proven histologically.
Other criteria include patients with cancer syndromes such as Lee-Fromenate and Rothman-Thompson are excluded. The latent period between initiation of radiotherapy and histological diagnosis of second neoplasm is more than 4 years.
Treatment plans for radiation-induced sarcomas vary on the grade of tumor. A tumor grade is the description of a tumor based on how abnormal the tumor cells and the tumor tissue look under a microscope. It is also an indicator of how quickly a tumor is likely to grow and spread.
The following is a typical tumor grading classification. GX. The grade cannot be assessed. It is an undetermined grade. G1, well differentiated. It is a low grade.
G2, moderately differentiated, intermediate grade. G3, poorly differentiated high grade, and G4, undifferentiated high grade.
If the tumor's tissues are normal looking and similar to other tissues, it is considered differentiated. On the other hand, if the tumor's tissues are abnormal looking, it is labeled as undifferentiated or poorly differentiated. The higher the grade of the tumor, the more quickly it will spread and grow.
Now back to the treatment of sarcomas. If the sarcoma is a high-grade tumor greater than 5 cm, then the patient will undergo primary chemotherapy first, and that will be followed by a margin-negative surgical excision of the tumor.
The sarcoma is a low-grade tumor or high-grade tumor less than 5 cm, then the patient will undergo margin-negative surgical excision of the tumor first. Or if the surgery is difficult or impossible, then they will have systemic chemotherapy.
According to the Kaplan-Meier survival cure, patients have a 35% survival rate in 5 years and a 41% survival rate in 5 years when treated with intention to cure their sarcoma. Although if the patient is over the age of 40, the chance of survival for 5 years decreases immensely.
In conclusion, approximately 11,000 people are diagnosed with a soft tissue sarcoma each year in the U.S. alone. Yet, this only accounts for less than 1% of all cancer cases in the United States. Approximately 2,900 people in the U.S. are diagnosed with bone and joint sarcomas, which accounts for less than 0.2% of all cancer cases. Clinical trials are being conducted all around the world to help treat and cure radiation-induced sarcomas. But even with treatment plans such as chemotherapy and surgery, survival past 5 years is poor. Young Bert will have to be monitored for the following symptoms.
Some other examples of human evidence for radiation carcinogenesis are
Oh, thanks, Claire.
Wait, I think I'm getting something.
No.
42 bone sarcomas were found of the 1468 malignancy of different historical types. Alright. Microscopic or radiological evidence of
Thanks, Claire. We're here at Laura Moore Memorial Hospital.